Good morning, good afternoon, good evening. This is Dr. Garais, BIO117, Anatomy and Physiology 1. This is Anatomage, Unit 1, Laboratory 1, Week 1, here at lovely ECPI University School of Nursing. So this is the heart. So the first thing you have to ask yourself is orientation. Are you in the front or the back? Well, let's just tell you right now, I'm in the front, and how do I know? Look at that big aorta, it's going up and around. We colored it red for your learning purposes. The apex is here, right, the tip, and the base are where all the great vessels are, including your aorta. Now, if you remember your box diagram, the atria are smaller. So you could see how this yellow is smaller than this blue. So this has to be an atrium, and this has to be a ventricle. Now, the big question is it right or left? Okay, I know I'm in the front. I don't know what's in the front on this particular patient, but if I remember my my box diagram, and if you forgot, we have this right here. If you remember the box diagram, if you look, what connects into the right atrium is your superior vena cava and inferior vena cava. Now, if we look here, what do we got here? Superior vena cava, inferior vena cava going into this atrium. So this has to be the right atrium. Now this little part here is called an auricle. It's just an outpocketing. It's an old school term, but all of this in yellow is your right atrium. And of course, if this is your right atrium, right ventricle, and all these surrounding little arteries here are your coronary arteries. Those are the arteries connected right here into your aorta and feeding your heart. Because remember, your heart is a muscle and it has to eat as well. So those are the anterior parts. Know them. Next, let's look behind us. Now we took out, if you see here, the aorta. Ooh, I forgot to mention one more thing. Now before we move on, if I know this is my right atrium and this is my right ventricle, remember our diagram. Again, back to this. What comes out of the right ventricle? The pulmonary artery. Well, we're looking at our right ventricle. What's coming out right there? And we colored it purple for pulmonary artery, right? So that's coming out right there. So when we look in the back, you could see the pulmonary artery is now here. It's the same thing, and we colored it purple. Now, you'll notice there's two sets of branches coming out of that pulmonary artery, right? So that's why we call this the pulmonary trunk. Like the tree, like a tree trunk, it's going to have branches. So you have the left side and the right side, and that's your pulmonary artery. Now we know that the yellow was an atrium, the blue was a ventricle. You could see here in the back, there's a small room or chamber. That's got to be an atrium. And there's a big room or chamber. And you'll notice here, this big part of your coronary system here. This is your coronary sinus. And that's how you also know that you're in the posterior. Here's your interventricular sulcus. It's like a little groove in between your ventricles. Okay, so this is the right, this is left. Left ventricle over here, left atrium over here. Now, we look at your left atrium, and there's these vessels coming out of them. Now, if we remember what goes into the left atrium, again, we look at our box diagram. I look at the left atrium, and who is entering my left atrium? That is my pulmonary vein. Therefore, when we look at the posterior of our patient, right here, you have your left atrium. Oh, let's get back. If we look here of our left atrium, there's going to be one side going into your left lung, and another side right here going into my right lung, just like you had with the pulmonary artery. So pulmonary artery and your pulmonary veins connecting into your left atrium. All right, those are the external views of the heart. So let us now go into some internal views. What does the inside of the heart look like? So let's go back to the front. And if we're looking at the front, we have to go cut inside, and we need to use our dissection tool for that. So let's click on that. You see it's already activated. So I take where I want to cut, and I want to cut in between here. So cut. So see that little blue line? I made a cut, and then I want to make this part disappear. And I do that, turn it over, and what do I see? I see the internal structures of my right atrium, right ventricle, which we already identified. And we could see them animated and moving. Also know your PQRST, right? We already discussed that before. Now, another reason why you also know that this is your right atrium, remember your SA node and your AV node? Your SA node over here, that is the pacemaker. And your AV node over here, those are the brakes. It's gonna have to slow down that pacemaker a little bit. And if you're looking right here, the thing that looks like an upside down parachute, that is, if it's on the right side, we are now talking about your tricuspid. Stop them animations. Another difference between atrium and ventricle, do you see how thin the walls are on the atria? But look on the ventricle, see how thick? Very, very thick myometrium. And if you look inside, there's a lot of branches like a forest, and that is called your trabeculae carnae. That's how you know you're in a ventricle. Now, of course, your tricuspid is an AV valve in between your atrium and ventricle, right? And on the right side is your tricuspid. If you'll notice that there's strings at the end, those strings are called chordae tendineae. They're called tendineae because they connect into this finger-like muscle right here called your papillary muscle. Remember, tendons are connective tissue that connect into muscle. And that's why all the valves in your heart is called the skeleton of your heart. Right? It's kind of like a misnomer, but you know, it's okay. We get it. So, if I cut the heart this way, longitudinally, and I'm asking for this stuff, and if it's the right atrium, I could ask about the SA and AV nodes. I could ask about the tricuspid. I could ask about the chordae tendineae. I could ask about the papillary muscle. And this thing right here, that's the papillary muscle. Okay? Now, let's undo this cut, and let's do one last cut because we have two more valves that we have to talk about. Those, if it looks like a parachute, that's got to be the AV valve or atrioventricular valve. And it's between an atrium and a ventricle. Now let's look at the ones that, in my opinion, look like an ashtray. Again, I hit the clipping tool, the blue dissection tool, and then I cut along here because that's where the aorta and the pulmonary artery meet. I turn it over, and lo and behold, look what I see. Remember, this is your right ventricle right here, going into the bit of the purple part, which was your pulmonary trunk, also known as your pulmonary artery. And if you look at it here, you have these ashtray-like or semi-lunar valves here. So this has to be the pulmonary semi-lunar valve. We already know that the aorta was labeled red, and if you look inside, right, that is your aortic semi-lunar valve. And if I turn on the animation, that's what they look like. Do you see how they're very different than your atrioventricular valves? These are semi-lunar valves. And if you cup your hands, just like the way this looks like, it looks like, you know, a crescent moon or, you know, like a quarter moon. Okay. So that's that. Let me undo the cut. Let me get it back to normal. I'll do it, use my finger, I guess. And there is, of course, the structures of your heart. All right, the second part of this unit 1 was the histology part. So let's minimize this. And let's go here. This is your typical blood smear. As you can see, the majority of the cells are red blood cells. What do the red blood cells look like? Biconcave discs. They look like Cheerios. There's nothing in the middle, right? Let's find one that has that looks like a Lifesaver or Cheerio. Well, I can't find one. So let us start labeling stuff. So if I was on an exam and I said, hey, what's this on a peripheral blood smear? You tell me red blood cell. And if we saw these two big purple things, okay, you talk about these in generalities, that's your white blood cell or leukocyte. Red blood cell, white blood cell. Now, you'll notice somewhere on the slide, you see that? It's like dirt. You guys see that one? Let me point at it. This one's really, really what we're looking at. You see it right there? They look like little spots or speckles. Let me move this one a little. Let's move this one back a little. Why won't it move? Okay. Well, you see it. Well, that too. Little specks of dirt. Here's another one. That's your platelet, also known as your thrombocyte. So platelet, red blood cell, and here's a white blood cell. These are two white blood cells. Okay? Alrighty. So that's how we would go on an exam, on your checkoff. You come in, I ask you to open up the histology, you find the peripheral blood smear, and then I start doing arrows and be able to identify your erythrocyte, red blood cell, leukocyte, white blood cell. Here's another different leukocyte, white blood cell, and of course these little, these little bits. See that bit right there? It's like little bits of dirt, like that. And that's your platelet, also known as your thrombocyte. Now let's look at some specific, back to histology. Let's look at some specific blood cells. So let's look at blood smear. Well, better way is let's just look at all the blood. Make our life easy. Let's look at what a typical granulocyte looks like. Okay. Do you see how there's lots of granules? That's how you know that's a granulocyte. See how it's like grainy and there's like, it looks like there's rocks in there? That's a granulocyte. Let's find another one. A better one so that we can here you go. Much better one. This is of course a neutrophil. It's a granulocyte because you can see there's granules, there's little rocks. Let me see if I point in. There's little rocks in here. And you could also see there's multi-lobes or polymorphonuclear nuclei. So this is a neutrophil. First one on the scene, and they're also called PMNs, and they are signaling that most likely your patient has a bacterial infection. And we'll look at here overall. Maybe not, but that's a neutrophil. Let's look at another one. Now, oopsies. Now on my notes that I put last night, I also put down what exactly they look like. Like for example, let's look at eosinophils. See, do you see the eosinophil? There's a lot of granules. Remember, anything fill, granules. But you see here, there's only 2 lobes. There's not 3 or 4. So that's how you know it's a eosinophil. And you have 2 lobes, right? Or bilobular, eosinophil. Bi, think 2 things. 2 things that eosinophil signal is parasitic infection and allergies. Let's look at one more. Let's look at a basophil. Now, if you look at this, it's not a great picture of it, but the basophil, see how most of it's all filled up? That's a basophil. But I want to get at histology again. Eosinophil. Let's look at a monocyte. Look at this one. Now, if you look at this monocyte, do you see how it's not really two? It looks like one big, I don't know, Lululemon symbol. Looks like a U, but you could see it. That's only one nucleus. That's why, hence we call it monocyte. Mono means single. And if you look at it, you pan back, it's kind of big in relationship to red blood cells. And remember, because monocytes turn into macrophages, and it can get much bigger than that. And remember, the function of macrophages, of course, phagocytosis. It's going to start eating up, when properly directed by a lymphocyte, it's going to start eating up any pathogen. All right, so that concludes the laboratory, and we'll see you in class.